Have you ever had one of those days where you just can't seem to think clearly, no matter how hard you try? Maybe you're sitting there, trying to recall someone's name or remember what you were about to do next, and it's just not coming to you. You might even find yourself feeling more forgetful or foggy-headed than usual. And if you're over 60, this can be frustrating. It's a common experience for many as we age, but there's something you might not know. Some of the medications you're taking could be making things worse. Now, I know that medications are often prescribed with the best intentions, but they don't always come without side effects. And one of the side effects that's not talked about enough, especially for older adults, is how certain medications can impact our cognitive function. The mind fog, the forgetfulness, and that feeling of being out of it could be linked to the very prescriptions we're relying on to stay healthy. In today's video, I'm going to walk you through 5 common medications that are known to cause memory issues or make you feel mentally sluggish. The good news is, by understanding these medications and discussing alternatives with your doctor, you can take steps to protect your brain and ensure that your cognitive health remains sharp for years to come. So, let's start with the first medication on the list, antihistamines. Many of us take antihistamines for allergies, colds, or even seasonal sniffles. But did you know that they can contribute to brain fog and memory problems? Antihistamines work by blocking histamines, which are chemicals involved in allergic reactions. However, some of these drugs, especially the older first-generation ones, can also block acetylcholine, a neurotransmitter that plays a critical role in memory and learning. When acetylcholine is disrupted, it can lead to confusion, forgetfulness, and overall cognitive sluggishness. You may have taken something like Benadryl or another over-the-counter antihistamine to help with allergies or insomnia. While these can be effective in the short term, they come with a significant downside for brain function, especially with long-term use. That's why it's important to talk to your doctor about alternatives. There are newer, second-generation antihistamines available that are less likely to cause cognitive side effects. Drugs like Claritin or Zyrtec are less likely to cross the blood-brain barrier and interfere with brain activity, making them better choices for older adults concerned about memory loss. If you've been feeling foggy after taking an antihistamine, it might be worth asking your doctor about switching to one of these newer medications, or even considering non-pharmacological options like saline nasal sprays or allergy shots that might be gentler on your cognitive health. Let's now move on to another group of medications, benzodiazepines. These are medications that are often prescribed to help with anxiety, sleep disorders, or even muscle relaxation. Examples include Valium, Ativan, and Xanax. While these medications can be helpful in the short term, especially for calming nerves, they can also significantly impair your memory and mental clarity, particularly when used for extended periods. Benzodiazepines work by enhancing the effects of a neurotransmitter called gamma-aminobutyric acid, GABA, which has a calming effect on the brain. This calming effect can make it harder to concentrate, recall information, or even think clearly. In fact, studies have shown that long-term use of benzodiazepines is linked to an increased risk of cognitive decline and dementia. This is especially concerning for older adults, as our brains become more sensitive to the effects of these medications as we age. If you've been using benzodiazepines for a while and notice that your memory isn't what it used to be, it might be time to discuss other options with your doctor. There are alternative medications and therapies that can help with anxiety or sleep issues without compromising your cognitive health. Cognitive behavioral therapy, CBT, for example, has been shown to be effective in treating anxiety and insomnia without the risk of memory problems. Your doctor might also suggest other medications that are less likely to impact your cognitive function. Now that we've covered antihistamines and benzodiazepines, let's talk about statins, the medications commonly prescribed to lower cholesterol. Statins, such as Lipitor or Zocor, have been shown to reduce the risk of heart disease by lowering cholesterol levels. However, there's growing evidence that these medications may also contribute to cognitive problems, particularly in older adults. Some people who take statins report experiencing memory lapses, difficulty concentrating, or confusion. The reason for this is still not completely understood, but researchers believe that statins may interfere with the production of certain brain chemicals that are necessary for memory and cognition. In particular, statins can lower the levels of coenzyme Q10, a substance that plays a role in energy production in cells, including brain cells. If you're taking statins and noticing that your memory seems to be getting worse, it's important to discuss this with your doctor. There are alternative ways to manage your cholesterol, such as dietary changes, exercise, or other medications that may have fewer cognitive side effects. Your doctor can help you assess your options and find the best approach to keeping both your heart and brain healthy. As we've seen so far, there are several medications commonly used by older adults that can cause mental fog, forgetfulness, and even cognitive decline. But the good news is, you don't have to just accept these side effects as a part of aging. By having an open and honest conversation with your doctor about the medications you're taking, you can explore alternatives and find a treatment plan that works for your overall health, not just for your body, but for your mind as well. So, before we wrap up this part, let's review what we've covered. We've discussed the impact of antihistamines on cognitive function, the risks associated with benzodiazepines, and how statins might affect your memory. If you're taking any of these medications and experiencing brain fog or memory issues, it's important to have that conversation with your doctor. There's no need to struggle with mental fog when alternatives are available. Next, we'll dive into the last two medications that can impact your mind and how you can take steps to protect your memory moving forward. But before we get into that, I encourage you to take a moment to like this video and subscribe to Evergreen Elders for more helpful tips on maintaining your health as you age. I'd love to hear your thoughts in the comments. Have you noticed any cognitive changes while on medication? Let's keep the conversation going. Now that we've covered antihistamines, benzodiazepines, and statins, let's move on to another group of medications that might be affecting your cognitive health: antidepressants. Many people over 60 are prescribed antidepressants to help with mood regulation, especially if they're dealing with depression, anxiety, or other mood disorders. Common medications in this group include SSRIs, selective serotonin reuptake inhibitors, like Prozac or Zoloft, and SNRIs, serotonin norepinephrine reuptake inhibitors, such as Cymbalta. While antidepressants can work wonders for improving mood and overall well-being, they can also come with some side effects that affect mental clarity. One of the most common issues with these medications is that they can cause what's often referred to as brain fog. This can include feelings of mental sluggishness, difficulty concentrating, and problems with memory. The way antidepressants work is by increasing levels of serotonin and norepinephrine in the brain, both of which play an important role in regulating mood. However, by altering the levels of these chemicals, the medications can sometimes interfere with cognitive processes as well. It's important to keep in mind that not everyone will experience these side effects. But if you've been taking an antidepressant and feel like it's harder to think clearly or remember things, it might be worth discussing with your doctor. There are other treatment options available, such as psychotherapy or alternative medications, that may offer similar benefits without the cognitive drawbacks. For some people, especially older adults, antidepressants can also interact with other medications, potentially amplifying cognitive side effects. This is why it's important to keep an open dialogue with your healthcare provider about any changes in your mental clarity or memory while on these medications. A well-rounded treatment plan may involve combining medication with lifestyle changes, exercise, and cognitive therapies that can support brain health while addressing your emotional well-being. Now, Let's turn our attention to anticholinergics, a class of medications that are frequently prescribed to older adults for conditions like bladder issues, gastrointestinal problems, and Parkinson's disease. You might recognize some of the common names of these medications, like oxybutynin or benztropine. While they can be quite effective for treating these conditions, anticholinergics have a major downside when it comes to cognitive health. These medications work by blocking acetylcholine, a neurotransmitter that plays a critical role in memory, learning, and overall brain function. When acetylcholine levels are reduced, it can lead to problems with memory, concentration, and even confusion. For older adults, the effects of anticholinergics can be particularly pronounced, increasing the risk of cognitive decline, especially in those who already have mild cognitive impairment or are at risk for dementia. If you've been prescribed an anticholinergic and have noticed a decline in mental clarity or even confusion, this is something you definitely want to bring up with your doctor. There are often alternatives to these medications that don't come with the same cognitive risks. For example, other medications for overactive bladder or Parkinson's disease may have fewer cognitive side effects. By having an honest discussion with your healthcare provider, you can explore alternatives that help manage your condition without putting your memory at risk. Now that we've touched on antidepressants and anticholinergics, let's move on to the final medication group on our list, opioids. These powerful pain relievers, which include medications like morphine, hydrocodone, and oxycodone, are sometimes prescribed to manage chronic pain, especially as we age. While opioids can provide much-needed relief for pain, they can also come with significant cognitive side effects, particularly with long-term use. Opioids work by binding to receptors in the brain and blocking pain signals, but they can also affect brain function in other ways. One of the most common side effects of opioid use is a feeling of drowsiness or sedation, which can make it difficult to think clearly. Over time, especially with prolonged use, opioids can lead to memory problems, difficulty concentrating, and even confusion. For older adults, the risk of these cognitive side effects can be especially high, making it harder to stay mentally sharp. If you're using opioids to manage pain and are experiencing cognitive difficulties, it's important to talk to your doctor about potential alternatives. There are many other pain management options available that may be just as effective without the same mental fog. Physical therapy, acupuncture, and non-opioid medications are just a few examples of alternative treatments that can help you manage chronic pain while keeping your mind clear. As we've discussed, there are several medications commonly prescribed to older adults that can contribute to cognitive decline, mental fog, and memory problems. But the good news is that you don't have to accept these side effects as a part of aging. By discussing your medications with your doctor and exploring alternatives, you can protect your brain and maintain your mental sharpness as you grow older. Before we wrap up, let's quickly review the medications we've covered in this part: antidepressants, anticholinergics, and opioids. If you're taking any of these medications and noticing cognitive changes, it's time to talk to your doctor about your options. Remember, there are often safer alternatives that can help manage your condition without the risk of affecting your memory or overall brain function. As we move forward, I encourage you to take a moment to reflect on how your medications may be impacting your cognitive health. If you're noticing any mental fog, confusion, or memory issues, reach out to your healthcare provider and have that important conversation. Your brain is just as important as your body, and there are always options to help keep both in tip-top shape. Don't forget to like this video if you found it helpful, and subscribe to Evergreen Elders for more valuable health tips. In the next part, we'll dive into how to talk to your doctor about finding alternatives to these medications and what steps you can take to protect your memory in the future. I'd also love to hear your thoughts in the comments below. Have you ever experienced mental fog from any of these medications? Let's chat. Now that we've gone over some common medications that can impact your memory and cognitive function, antidepressants, anticholinergics, and opioids, let's talk about how you can take action and protect your brain health moving forward. As we age, it's not uncommon to face health challenges, but it's important to remember that you're never alone in navigating these changes. If you're experiencing memory issues or brain fog, you can take steps to minimize these effects, starting with a conversation with your doctor. The first step is simple. Open up about your concerns. Your doctor may not be aware of the mental fog or memory lapses you're experiencing, so it's important to bring it up. Be honest about the impact it's having on your daily life. You might say something like, "I've been having trouble focusing or remembering things lately, and I'm wondering if my medication could be the cause." Your doctor is there to help you find the best solutions, and your health is their top priority. It's also important to remember that you're not stuck with the medications you're currently taking. There are alternative treatments available for many conditions that don't come with the same cognitive side effects. For example, if you're on antidepressants and experiencing brain fog, your doctor might suggest adjusting your dosage, switching to a different type of medication, or even exploring therapy options like cognitive behavioral therapy, CBT, which has been shown to help with depression and anxiety without the need for medication. Therapy can also support cognitive health by teaching you coping skills and ways to manage your emotions more effectively. When it comes to anticholinergics, your doctor may offer different medications to treat the same conditions without affecting your cognition. If you've been prescribed an anticholinergic for overactive bladder or Parkinson's disease, for instance, ask about alternatives like mirabegron, which works differently and tends to have fewer cognitive side effects. Sometimes, non-medication options such as pelvic floor exercises for bladder issues or physical therapy for Parkinson's disease can help you manage symptoms without putting your brain at risk. For those of you taking opioids for chronic pain, it's crucial to discuss potential non-opioid pain relief options. There are many ways to manage pain without the side effects that come with opioid use. Your doctor may suggest physical therapy, acupuncture, or other treatments that help relieve pain while preserving your mental clarity. Non-opioid pain relievers like acetaminophen or NSAIDs, like ibuprofen, are often good options as well, though it's always important to talk to your doctor about what's right for you. Another option to consider, especially if you're dealing with chronic pain or other long-term conditions, is a multidisciplinary approach. This involves combining several different types of treatments to address both your physical and cognitive health. For example, a combination of medication, physical therapy, and lifestyle changes, like exercise and nutrition, can work together to keep you healthy and sharp, without the side effects that might come from relying too heavily on any one medication. Lifestyle changes also play a huge role in protecting your memory and cognitive function. Whether or not you're on medication, the way you take care of your brain and body has a major impact on your mental health. Regular physical exercise, such as walking, swimming, or yoga, increases blood flow to the brain, which can help keep your mind sharp. Exercise also releases endorphins, which boost your mood and overall well-being. Incorporating brain exercises into your routine is another powerful way to support your memory. Activities like puzzles, reading, or learning a new skill can help maintain and even improve cognitive function. Music is another fantastic tool, and we've already discussed how certain playlists can stimulate the brain, so make sure to keep that in mind as part of your daily routine. Engaging in social activities and maintaining meaningful connections with friends and family also promotes brain health. Social engagement helps keep you mentally active and prevents feelings of isolation, which can affect your mood and cognitive health. Nutrition also plays a role in brain function. A diet rich in omega-3 fatty acids, antioxidants, and vitamins, found in foods like fish, berries, and leafy greens, can help protect against cognitive decline. Don't underestimate the power of drinking enough water too. Staying hydrated is essential for mental clarity, as dehydration can lead to feelings of confusion or fogginess. One thing I want to emphasize here is that you're in control. You have the power to make informed choices about your health and to ask questions. Your doctor is there to guide you, but ultimately, you are the one who gets to decide what works best for your body and your brain. And remember, it's never too late to take charge of your cognitive health. Even small changes, like incorporating a daily walk or taking up a new hobby, can make a big difference over time. In addition to discussing alternatives to medications, it's also important to regularly check in with your healthcare provider about any changes in your health. Medications that may have been appropriate a few years ago might not be the best choice now. As we age, our bodies change, and so do our needs. A good relationship with your doctor allows you to stay on top of these changes and ensure that you're always getting the best possible care. I also encourage you to talk with your doctor about managing your medications more effectively. Sometimes, medications that aren't necessary anymore might be causing more harm than good. If your doctor suggests tapering off a medication, be sure to follow their guidance, as stopping suddenly can sometimes have its own set of challenges. A gradual reduction may be a safer and more effective approach. I want to leave you with this final thought. You deserve to live your life to the fullest, with clarity, focus, and joy. Don't let the side effects of medications or aging slow you down. By having open, honest conversations with your doctor, staying informed, and making healthy choices, you can protect your memory and mental well-being as you get older. If you found this video helpful, don't forget to give it a thumbs up, and please share it with anyone who might benefit from this information. And if you haven't yet, be sure to subscribe to Evergreen Elders for more tips and advice on living your best life after 60. I'd love to hear your thoughts too. Have you had a conversation with your doctor about your medications and memory? Drop a comment below and let's talk. Keep shining and taking care of your mind. You've got this.